Both men and women tend to report difficulty with sleep as they get older. In general, as people get older, they tend to go to bed earlier and wake up earlier than they did in their younger years. People also often complain that their sleep is more easily disturbed by noise or light as they get older. One of the most common complaints of women during the menopause transition is difficulty sleeping, also known as insomnia. There are multiple causes for insomnia during the menopause transition, including significant stressors experienced by women at this time in their lives. These relate to job-related stress, loss of a life partner through divorce or death, and providing care for younger or older family members. Insomnia can also result from chronic illnesses that tend to be more common at midlife, pain issues, and use of certain medications. Moreover, hot flashes and night sweats, which are the most common symptoms of the menopause transition, also contribute to sleep disturbances. Women often report difficulty with falling asleep and staying asleep, and typically report early morning awakening. Finally, mood problems and anxiety, which are also common during the menopause transition, can contribute to insomnia. The first step in management of sleep problems during the menopause transition relates to sleep hygiene and developing good sleep habits. Cognitive behavioral therapy is an effective tool for management of sleep disturbances at midlife. However, cognitive behavioral therapy alone is often not enough for management of sleep disturbances. If there is an underlying medical condition like anemia, depression, restless leg syndrome, or obstructive apnea, that needs to be appropriately addressed. Disorders like restless leg syndrome tend to get worse after menopause. In addition, sleep apnea tends to be more common in postmenopausal women as compared to younger women. Women may also not present with the more typical symptoms of sleep apnea that are seen in men, such as snoring. Instead, they may present with nonspecific symptoms like fatigue and headache. Women may need to be referred to a sleep center for specialized care for diagnosis and treatment. In terms of medications, most over-the-counter sleep aids are not effective and may in fact be harmful. There are limited data to support use of melatonin for relief of menopause-related sleeping difficulties. There are a number of prescription medications that can be considered for treatment of insomnia, but adverse effects need to be discussed with your healthcare provider. Finally, hormone therapy can be a consideration for management of sleep disturbances in women who are experiencing significant hot flashes and night sweats that are contributing to their sleep disturbance.